My name is Emily Meglin, and I am part of Clinical Group 113. This semester, we worked at UCMC on floor 3 South, which was a neuroscience floor. On that floor, we saw a lot of patients come in with symptoms of strokes. More commonly than hemorrhagic strokes, our patients had ischemic strokes. So today we'll be teaching our patients everything they need to know about ischemic strokes. Ischemic strokes are defined as a loss of blood flow to certain parts of the brain, which results in a loss of neurologic function. There are essentially two types of ischemic strokes. There's embolytic and thrombolytic. Embolytic occurs when a clot forms in another area of the body, for example in the leg, and it breaks off and travels through the bloodstream, which then gets stuck in the arteries of the brain, which results in the loss of blood flow. On the other hand, we have thrombolytic, which happens when plaque builds up in the arteries of the brain, narrowing those blood vessels, which restricts the blood from flowing as freely as it needs to throughout the brain. And because of that, it will lead to that loss of neurologic function. We will be teaching you the signs and symptoms of strokes, should you have another one, and along with treatment, medication options, and what life will look like after your stroke.
Hi, my name is Jamie Ryan, and I'm going to be teaching you on the signs and symptoms of a stroke today and things that indicate that you should go seek help. One of the major signs and symptoms of a stroke is face, arm, or leg weakness, especially to one side of the body. And these symptoms will occur on the opposite side that the clot is forming due to the fact that movement on one side of the body is controlled by the opposite side of the brain. Other symptoms of a stroke include trouble seeing in one or both eyes, a sudden severe headache with no known cause, facial drooping or weakness, arm weakness, and slurred speech. I know you're probably getting a lot of information right now and it's going to be difficult to remember all of this, so I'm going to go ahead and give you an acronym to remember these signs and symptoms by, and that acronym is FAST. F stands for facial drooping or weakness, A stands for arm weakness, S stands for slurred speech, and T represents time. And that time means that as soon as you recognize these symptoms, you need to get to the hospital and seek help as soon as you can in order to reverse and inhibit the long-term effects of the stroke. Hi, my name is Jody Ryan, and today I'm going to be teaching you about risk factors of an ischemic stroke. Some of these risk factors you can control, and some of them you can't. The most susceptible individuals to have an ischemic stroke are African American males who are over the age of 55. Family and personal history of a stroke, embolism, or transient ischemic attack, which is a mini stroke that lasts only a few seconds, also play a huge role. Other risk factors include diabetes, high cholesterol, obesity, physical activity, and sleep apnea, along with heart failure, high blood pressure, atrial fibrillation, vascular disease, and drug and alcohol use.
Hi, my name is Olivia Greathouse and I am in Clinical Group 113, and our project is about ischemic stroke and the patient that goes along with that. So I'm going to be talking about diagnostic tests to go along to try and diagnose an ischemic stroke and what that means. There's many means of doing this, including a CT scan, MRI, echocardiogram, carotid ultrasound, and a physical examination. A CT scan and an MRI are used to create pictures of the brain, and by doing this we can see if there has been any tissue damage, blockages, or clots that have traveled to the brain that would result in a stroke. A carotid ultrasound, we examine the carotid arteries in our neck right here, and we look for any blockages or blood clots in that area that could have led to a decreased amount of oxygen in the brain. A physical ultrasound or a physical exam helps determine any possible signs or symptoms that could have resulted from the stroke, and an echocardiogram examines the heart, and we look for blood clots there that could have traveled up to the brain to cause the stroke.
Hi, my name is Gabby Lesby, and I'm going to be doing the safety precautions part of our project. So first and foremost, the patient needs to make sure that they always have on their non-skid footwear when they are specifically ambulating to avoid slips and falling. And then as well as that, the environment should remain uncluttered just to avoid any tripping and falling that could have been avoided. And then also they should not be walking on any slick surfaces. If they do, definitely with the non-skid, like tile, hardwood, and wet surfaces. And then we need to make sure to communicate to them that if they want to get out of bed, they should press their call light. This is in the hospital. So a nurse or a PCA or somebody could come and help them get out of bed, and maybe they need to go to the bathroom or something. And then they should also be aware that some of the medications may cause dizziness, drowsiness, or increased risk of bleeding. So they just need to be aware of how the medications affect them. And then also with the environment, the hallway light or like a room light should be kept on, maybe some night lights, just so that the environment is lit and it's not dark, just so the patient doesn't fall or trip on something that may be in the way. I would ask them what assistive devices they're going to be using, like a cane, walker, scooter, and then I would also ask the patient what safety precautions that they need to implement at home to ensure that no falls occur. Then I would assess their socioeconomic status to ensure that they have a good living situation and that they can afford the assistive devices that they need, and make sure that their environment is a safe one. I would ask them if they live with somebody or if they have somebody that can assist them with their daily activities. And then I would also ask them if they take stairs frequently, if they have them in their home. And if they do, I might recommend a stair assistive device. Or if they can't get one of those, I would also recommend maybe just living on one floor so they avoid stairs altogether. And then I would also allow for cultural competency. I know that some cultures, they sit on the floor for meals and stuff. So I would ask them and assess for their beliefs and everything. And just if they do have that cultural belief, or if they have that tradition, then I would make sure that we find a way to do it safely. At the end of all of this, I would make sure that they can recall to me what they've learned. I would ask them, how should your environment look? Should it be cluttered? Should you have everything all over the place, or should it be really clean and tidy?
Hi, my name is Emily, and I'm going to be teaching about diet and nutrition. So after having a stroke, you are at higher risk for developing secondary stroke. While you're recovering, there are some important things to remember. To decrease your risk of stroke again, you may want to try avoiding saturated fats and cholesterol, increase your monounsaturated fat intake, and limit sodium while also increasing your potassium. Avoiding saturated fats and cholesterol decreases your chances for stroke by almost 13%. Some examples of cholesterol-containing foods are things like lunch meats, butter, lard, palm oil, or fried or processed foods. However, you want to increase your intake of monounsaturated fats, which can reduce stroke risk if eaten routinely by 17 to 26%. These fats actually work by increasing your HDLs, or good fats, and lowering your LDLs, which are fats that tend to clog your arteries. To increase monounsaturated fats, eat foods like olive oils, canola oil, sesame oil, seeds and nuts, and avocados. Another thing you might want to do is also reduce your blood pressure. An elevated blood pressure can increase your risk for stroke drastically by putting all that strain on your vessels. So reduce your blood pressure by increasing your potassium and limiting sodium to 1 teaspoon a day. You eat potassium-containing foods like bananas, leafy green vegetables, and beans and legumes. It can be hard to get to the store and drive and just prepare healthy meals for yourself after having a stroke, so contacting a family member is a great option while you're recovering. A great way to make sure you have a healthy diet is to make a menu with 3 meals a day, 7 days a week, and discuss snack ideas with your family members or dietitian. The farmer's market is a great place to get cheaper fruits and vegetables if you are near one. If you have any sort of culture where you follow a diet For example, Hinduism, you would avoid animal products, garlic, and onion. Sometimes you use a lot of salt to replenish the flavor, so it might be a good idea to speak with your doctor about potassium salt substitutes so you can still enjoy the flavors and adhere to your religious beliefs. We still want to make sure you have complete access and ability to grocery shop. So if you do not have access, there are tons of other options to help you figure out the best diet for your recovery.
Hi, my name is Grace Carter, and I'm going to be teaching about the medication aspect of this teaching project. So, as for medications, tissue plasminogen activator is going to be given to the patient within the first 3 hours after their onset of stroke symptoms, and it's going to be given IV. The reason for this is it's going to immediately go in and restore the blood flow to the patient by dissolving those clots that were causing the stroke initially. Now, two other kinds of drugs that will also be given to stroke patients will be anticoagulant drugs and antiplatelet drugs. Both of these are mainly used as a preventative measure for the patient. They're just going to help prevent the blood clots from forming in the first place or interfering with the blood clot formation process to prevent a secondary stroke from occurring. Now, just besides the sheer definitions and functions of the medications themselves, patient teaching is extremely important with medications because there can be a lot of discrepancies when a patient goes in to self-administer these medications to themselves. So, before teaching occurs, you want to make sure that you assess the health literacy of the patient first and foremost. The reason for this, you want to make sure that they're understanding the teaching well, so you want to make sure that you know their health literacy before anything else. The nurse should also assess for any barriers that may come up during the teaching. For example, you may be dealing with a non-English speaking patient, and if you can assess that barrier beforehand, then you want to make sure that you get an interpreter involved. And the interpreter can allow for that patient to ask any questions that the nurse can answer. And it also just allows for the patient to adhere to the teaching a little bit better so they understand their medications in a more proper manner. Then, during the teaching, you want to make sure that you are avoiding medical jargon. This just causes the patient to become more confused because a lot of the time they don't understand the big medical terms that are being used by nurses and healthcare professionals. You want to mainly stick to plain language, something that your patient can understand based on their health literacy level, just so they can understand the teaching properly. Then the nurse should also point out the instructions that are listed on the patient's prescriptions. This is just so when they do go home after they are discharged, they're able to just really clearly look on their prescription to know how they need to be taking their medication. Then after the teaching is done, you want to make sure that you ask your patient to teach back to you what you just taught them. This kind of allows for you to point out any miscommunication or discrepancies between your teaching so the patient can actually fully understand everything that you taught them. Besides that, you want to make sure that you're providing them with a physical copy of the teaching that you just provided. So right here are listed all the medications that they'll be taking. It lists functions and the name of the medication. This is just kind of a reference that they can use when they're at home after they're discharged to allow for a better self-administration of their medication when they're at home, and they kind of understand a little bit more without having to call often into the hospital asking more questions.
Hi, my name is Davida Alberstadt, and I'm going to discuss some treatments after discharge in regards to an ischemic stroke. First and foremost, managing health conditions is absolutely crucial. For example, it's important to maintain a healthy weight and eat a variety of healthy foods such as vegetables, lean meat, whole grains, and fruit. It's also important to check your blood pressure and make sure your blood sugar levels are under control if you have hyperglycemia or diabetes. And please make sure you are taking your prescribed medications at the correct time and dosage. Some medications include antiplatelets and blood thinners such as aspirin and clopidogrel, as well as warfarin. Also, I would recommend wearing pressure stockings since they can be effective at preventing venous thromboembolism, but I would not recommend wearing them if you have peripheral vascular disease affecting your lower extremities. Lastly, there are stroke rehabilitations that I would highly suggest for you to go to because they help you relearn skills that were lost, and it can also help you regain that independence and improve overall quality of life.